Assalamualaikum everyone, welcome back to this channel. This is me Alia Waheed and you are on the channel of Medicare. So as you know that we have started a lot of practicals. Today we are discussing the pharmacy practice experiment number 7. So in the last experiment we have done the experiment number 6, which is about the preparation of allopurinol suspension. Now I am going to prepare a dusting powder, and the most famous dusting powder is the Zinc Starch-Talc powder. So let's start it. First of all, see the objective. So why we are preparing it? So seeing the objective. So the major objective of preparing this or dispensing this dusting powder is to create a fine powder having the zinc oxide, talc and starch that can be externally used to prevent the skin infections. So zinc oxide, talc and starch, 3 combinations are used in this powder, which are really effective for any skin infection that occurs on you, and you can just dust it off over your skin and it prevents all that. This is the major purpose of it. So if a patient comes who has a skin infection and doctor has prescribed him a dusting powder, and you have to dispense him 100 gram of the dusting powder, just you have to do that because to treat the skin infection. So how would you do that? Step by step we will see that. First of all, you will make sure that the zinc oxide, starch and talc, which are the major component of the dusting powder, should be present within your pharmacy. After checking it out, you have to see the product formula through the British Pharmacopoeia. So for the 100 grams, we need zinc oxide, BP, about 25 grams. So we are total making 100 grams of the powder, within which 25 gram is of zinc oxide, starch BP is of 25 grams and talc is of 50 gram. Okay, by mixing all of them we will total make the 100 gram of our dusting powder. So first of all, you have to weigh all of them, zinc oxide, starch and talc, one by one on the electronic weighing balance, and after that you have to mix them into pestle and mortar, and make sure that you will add them in the ascending order of their weight. After that you have to grind them in the pestle and mortar, and make sure you will make a fine the powder of it. Not a large granule should be present there because it can cause the irritation. So every particle should be very finely divided, right? So then after that you will transfer it into the powder shaker bottle. You will label it and dispense it to your patient. So major zinc oxide is used as an antiseptic agent. Starch is the absorbent, so it will absorb all the sweat that is present, because at the site of infection, if the sweat is present there, it can even worse the skin infection. So that's why the starch is there, that will absorb the excessive oil and sweat from that side, so that infection cannot be get worse. And talc is used as a lubricating at that side. So zinc oxide is the major one which is treating your skin infection right at the side, so it is only used externally. So antiseptic is always a substance which inhibiting the growth of the lubricant, the microorganism. Our lubricant is used to decrease the friction, and absorbent is any solid substance which remove the impurities from our contamination. Okay, so the Latin mean fit e metal compress mean make and send sparkling of the dusting powder. Make and send sparkling or dusting powder. And the Latin term undus more deco. Its mean should be used in a usual way. So you have to use the dusting powder in undus more duslet. Right, so this was all about preparation and dispensing of zinc starch-talc powder, and I hope that you will like this experiment. And if you find this video well, then please subscribe to my channel. and press the bell icon so that you can get the notification of all the videos that I will upload it in the next session. So in the next experiment, I will tell you the name of the next experiment that we will study is about preparation and dispensing of captopril syrup 1 mg per ml. Okay, so take care. Allah Hafiz.